All right, guys, welcome to our September office hours. I am accompanied here by Dr. Marrero. She is one of our providers here at Paloma Health. We're just going to go ahead and let some people trickle in. In the meantime, let me go ahead and kind of explain who we are and what we do. So my name is Alex Ruiz. I am the Director of Content and Community here at Paloma Health. And we are a full-blown online medical practice. That means that physicians like Dr. Marrero get to see you and treat you and your thyroid health. And that's also includes our blood test kits that we do from the comfort of your own home. Our providers can order labs, prescription management, everything like that. We also have a free mobile app, which is amazing. Lots of resources on there from blogs, recipes, even workouts, meditations to help with stress management and sleep, all the works. So if you are interested in becoming a member, you go to palomahealth.com, you sign up and become a member, and then you're able to book an appointment with people like Dr. Marrero. So without further ado, we're going to go ahead and get started with our office hours. So this is basically a chance for our community to ask our thyroid experts whatever questions they have pertaining to their thyroid health. So without further ado, I'm going to go ahead and pass it off to Dr. Marrero and we can get started.
Wonderful. Thank you. So hi, everybody. My name is Ailis Marrero, and I'm a family medicine physician with an obesity management specialty as well. And I came into Paloma as I was seeking to transition from my brick and mortar practice. I am specializing in metabolic health. So the thyroid was an integral part of everything that I wanted to treat, address, and help. So coming into Paloma was the perfect fit for me. And I have looked forward to joining the team and have been wanting to greet you all, and hopefully we can answer some questions today. So let's get to the first one here. And the first one that came up says, what are some good strategies for dealing with Hashimoto's brain fog and fatigue? Yes, that is so common. It's one of the top complaints for our members, our patients that deal with Hashimoto's. It is super prevalent and sometimes it's pretty hard to treat. But what I would say, initially, what we want to focus on is optimizing thyroid function. So you want to make sure that you are getting appropriately diagnosed, tested, and treated. And that includes doing an expanded panel of blood work to make sure that we are looking at all the parameters of thyroid health. That's number one. That would be my first step in addressing that. Once we are able to see your labs, that you're not only within good ranges, but you're in optimal levels, which is what we look at here in Paloma. Optimizing it with the appropriate thyroid medication. If you need combinations of medications, finding what is the right treatment option for you, that would be step one. Step two, once we have achieved that, is the hardest one to achieve. And that is looking at our lifestyle and our choices. Dietary modifications are usually a huge component of being able to deal with this brain fog and this fatigue because they impact immunity and they also help decreasing those flare-ups that can cause this brain fog. So meeting with our dietitians, cleaning up your diet. For the majority of our patients, the biggest culprits tend to be gluten and or dairy. So these are huge food groups, and finding out which are particular triggers for you can also help, as well as improving your sleep, your rest, decreasing your stress, allowing for movement, hydration. So as you can see, it's a multifaceted thing, but we approach it step by step and we guide you along the way to help with those symptoms. Then we have, can TPO antibodies go up and down? And does it matter if TPO lab is 50 or 500? Do TPO antibodies ever go away? So in theory, the higher your antibody levels, the more inflammation that is present in your Hashimoto condition. And our goal is to not only treat the lab, but treat you and your symptoms. So we use the antibody level as a guide. If we are working to optimize your thyroid function, I look at those levels periodically to make sure that we're heading on the right track. And everything that I mentioned before, optimizing thyroid function through optimizing your medication, your dosing, and the type of medication, thyroid replacements that we are using, optimizing your diet, your stress management, your movement, and your hydration. So, as those things improve, generally the TPO numbers tend to decrease. That's not always the case, and some patients will still always have some elevation in the antibody levels that remain a low grade inflammatory process, but they are feeling much better. So we always use them as a guide. They're not the definitive answer, it's not a direct correlation, but they can give us an idea as to what is happening, and I use them that way. Should a Hashimoto's patient take a thyroid supplement that contains iodine? So, this is a very nuanced question. Iodine is definitely important in thyroid health, but too much can also be a problem and can be problematic. So, I would definitely not do it, not self prescribe iodine for yourself or self administer iodine for yourself. I would definitely consult with your provider, your physician, your nutritionist team to see if you are deficient and if adding a certain degree of iodine would help you. What truth is there when a doctor says if your thyroid levels are normal, then any issues that you have, GI, fatigue, dry skin, are not thyroid related? That is the vein of our existence. Unfortunately, I can tell you, being a primary care physician, that not enough training in terms of every thyroid related condition, symptom is able to be addressed by your primary care physician. Resources are scarce. The majority of time we're pressed for time, so they won't be able to address all those things. Here at Paloma, it was a joy for me to find out that we are able to focus specifically on thyroid care, and as such, we can delve deeper into those symptoms and know that the lab values that we are looking at for optimization are not just those within normal ranges. We look for optimal ranges, and that's what we aim for. Let's see. Do you believe that it's possible to go off medication by changing your diet? So I I hesitate to have a definitive answer for this because there have been some patients in my clinical experience that were going through what we call a thyroiditis, like a short term inflammation of the thyroid that had a specific cause. Like, for example, I saw a lot of this during COVID. So we had COVID related inflammation of thyroid that caused the function to become RA. And after a period of time, the thyroid was able to recover and then continue to function back normally. So, in those senses, we can cease to have prescription or supplementation of thyroid for a number of patients. Some patients, if they have dramatic responses to dietary modifications, can potentially restructure and have some normal function of the thyroid again. So I'm not saying no, but for the majority of the patients, supplementation is going to be a lifelong thing. I have a more expanded question here by one of our members. I'm going to take a second to read over it. They are sharing some very specific information regarding their case. Was diagnosed with multiple myeloma, had a stem cell transplant, is currently on Synthroid 125. Uh, Medication helps with maintaining weight loss, but the question is, since the transplant and lots of weight afterwards. I'm back trying to gain some weight back. Does the dosage that I'm in prevent me from gaining weight? My last TSH was a few weeks ago, and my numbers are in normal range. So, this is where a very dedicated approach to your thyroid health is very important because although uh, thyroid supplementation is not a stimulant by any way, it does help aid in weight management, weight control, and sometimes in weight loss if you are in deficient states. So, what is that normal range? Are you in the higher levels of normal? Are you in the mid ranges? That's where it becomes very important to fine tune your care and go deep into the specifics of what you're going through, your results, and your dosing to come up with an answer for that. In addition to that, dietary support is going to be very important. How is your diet? What are you eating? Making sure that you are not only ingesting enough calories, but also the right amount. Working with our dietitians would be ideal in this scenario, and that's probably where I would head initially. Are thyroid nodules affected by thyroid hormone medications like levothyroxine? In other words, does the medication reduce the risk of existing nodules changing, or does it impact the progression of nodules developing? So this is a more specific question, and usually as a primary care, if nodules became a more pressing issue, I would be recommending the endocrinologist to follow up on that. But in general, um, we should be following those nodules irrespectively of your medication, of your dosing, and your replacement. Thyroid function may or may not be affected by the nodules themselves. So that's one of the important things, getting them looked at, getting them properly evaluated. And at this point, if you have multiple and they are changing in size, we would be definitely contacting the endocrinologist to have a look and then determine, are these active nodules? Are they inactive nodules? So a lot to unpack there. And we would definitely work in conjunction with endocrinologists to get those answers for you. Next one, what is the utility of dosing T3, liothyronine, in such a way as to match healthy circadian rhythms? This would require dosing before arising and several times throughout the day. I wonder the value of that. So, because liothyronine is the T3 is the actual thyroid hormone. Trying to mimic the production itself, it's kind of analogous to insulin. I often think of this when I'm talking to both my patients that have diabetes and hypothyroidism, and we're supplementing. It's going to be extremely hard to reach that point where we're mimicking what our bodies normally and naturally do. And it's even harder to get ourselves to be able to remember and take those doses consistently every day, all the days at different multiple times. It's hard enough for the majority of us to take something twice a day, let alone if we're going to be mimicking and doing like multiple times a day. It's often not feasible. It's often something that's not going to be practical for the majority of us. So, with that being said, in my particular practice, what I focus on is on the times of need. T3 is a shorter acting replacement hormone, so it's formulated to be taken at least twice a day. So most of my patients will have some version of that, and there is a subset of patients that do just fine with just the morning dose. So again, very individualized. We work with you to see what will work best in terms of finding optimal replacement and symptom management for you. Can you share your thoughts on NP thyroid being taken away from not available? Many of us just simply do not respond to Synthroid. I am very aware of that. And there are two completely different types of hormone replacements. Synthroid is a synthetic T4 hormone, and MP thyroid is a naturally desiccated type, which has both T4 and T3 combined in the same medication. So, first, we would need to be comparing apples to apples. So, we would be talking about other options within those ranges. So, just be aware Synthroid and MP thyroid are two completely different things. And as such, would expect different responses from each patient. Work with your provider to find the alternative that works best for you. We definitely have more options. Is it true that flax seeds can interfere with T4 absorption? Well, you have stumped me. I have not heard that, so I would have to do some research on that. Flax seeds are high in fiber and they encourage digestion significantly, but as affecting T4 absorption, I would have to confer. I would need to look up that information. I don't know. Let's see. The next member asks, I feel so confused about what to eat. This person had a full thyroidectomy some years ago and has hypothyroidism. Is there a clear list of things to limit to avoid completely? For example, they love broccoli, but have heard various things about whether or not it's good for them. Soy products, tofu versus edamame. Are there proteins that are better or worse than others? I would love some clarity around these, please. So, yes, there are very specific recommendations, especially for patients that are suffering from hypothyroidism. The other thing to consider is whether Hashimoto is playing a picture in there with the autoimmunity piece as well. As I mentioned before, usually the biggest culprits tend to be gluten and or dairy, but there are very specific different food types that can affect you individually, and becoming a detective at finding out which ones tend to be repeatedly your biggest triggers is going to be the best bang for your buck. It is not something that is very easy to do. It requires the process of an elimination diet in most cases, where you take out certain food groups and then add them back on, and then become in tune with the symptoms so that you can kind of figure out, again, detective work. What are your biggest triggers so that then you can start to find alternatives or avoid them as much as you can. Also, to make things even more interesting and complicated, for some patients, it's a quantity factor. So they do okay when they eat or ingest a smaller amount of the triggers, then whereas they're having them every day, then they can really feel the effects of that. So my recommendation there is to work with your dietitian, nutritionist, in simplifying the way that you can figure this out for yourself, and then testing, becoming your own detective, keeping symptom journals and trying to figure out. It's usually a lot of work up front, but can give you so much information that can definitely help you with your symptoms in that manner. And I have here, is it recommended to get COVID booster about getting after getting diagnosed with Hashimoto's? So super controversial in terms of COVID recommendations with patients with autoimmunity in general. Um, it's still for the majority of patients that have autoimmune conditions, was highly recommended because the autoimmunity would have put you at higher risk, especially at at the beginning of the pandemic, where none of us essentially had any type of antibody for this new virus that emerged. So I would definitely ask this question to your provider so that they can take into consideration all of your risk factors, and then come up with an educated decision about this in particular. Is it possible to lose weight with hypothyroid, and what is the best approach? Oh, I love this question. This is the crux of my matter. This is my life's work right now. So the answer is yes. I can tell you that there is hope and you can lose weight with even though you have hypothyroidism. One of the biggest challenges is that it is extremely hard, a lot harder than for the average person, because you have a lot of factors influencing that, but it can be done. And a lot of the principles, a lot of the pillars that I discuss with my patients are the same. We need to optimize thyroid function, and that's with the appropriate testing to see where you're at, the appropriate replacement with the appropriate medication. That would be initially the first thing. Then we start approaching the rest, which is probably more than 60% of the way. These lifestyle factors. Are you supplementing adequately? Are we looking at nutrient deficiencies? What is your nutritional plan? I don't speak of diets, right? Diets are in my book because none of them are sustainable long term for the majority of us. And all we think of when we think of diet is suffering and restriction. I don't want that. I want you to be empowered in your weight loss journey. So we take that diet mentality and we throw it out the window. So we talk about a nutritional plan, a nutrition plan. How can you optimize your eating with the best foods so that you can improve your chances of getting this weight off? And multiple things. We have an enormous toolbox that we can do, but know that it is possible. Find the right community to support you. It can be done. Uh, any interactions with levothyroxine and Vyvanse or any other stimulant medication for ADD or ADHD? Not as far as I know. Again, this is something that I would have to confirm for you. But right off the top of my head, I don't think so. I've had plenty of patients on both. Again, levothyroxine is not a stimulant medication. It's a thyroid replacement that can help metabolism, but it's not a stimulant itself. What happens to Hashimoto's after thyroidectomy? Would the autoimmune disease attack other organs when the thyroid is not there anymore? This is a fascinating question, which I had myself when I first started delving deep into learning more about Hashimoto's so that I could better treat and have options for our patients. And as a matter of fact, because it is an autoimmune disease, the answer is yes. Even after having the gland completely taken out, you could still have symptoms of Hashimoto's. And that's because the thought is that some of the autoimmunity cross reacts with other body tissues, meaning other organs, and the body can still interpret it as being part of the Hashimoto's autoimmune disease. So then it would flare up similar symptoms. So that is why, even after thyroidectomy, Hashimoto's patients are usually, well, they become hypothyroid, so we have to replace the hormone anyways, but we also optimize um, the same way as if you still had the thyroid gland but not functioning. So we pretty much look at it the same way, but in a smaller subset of patients after thyroidectomy, the symptoms dramatically improved because the organ that was the main cause is no longer there. But you can still have some of the symptoms. So that's a very interesting question. And we are approaching the last question. And it says, can bone loss from over medication of levothyroxine be reversed once your dosage is corrected? So that is one of the very important reasons of why it's very important to meet with a practitioner, a provider, a physician that knows thyroid function, thyroid replacement thoroughly. We here at Paloma stress that overcorrection is also harming. So we don't want to suppress that TSH. We don't want to put you in a hypermetabolic state. So we're very cautious about avoiding that. And the answer to that is a little nuanced. So it depends on how much bone loss and in what capacity, but definitely stopping the offending cause is of most important. So having, corrected that dose is super important. And then building up or preventing any further bone loss is going to be important as well. And that can be with medication, weight bearing exercise, and dietary influences, as well as supplements. So, a lot can be done to further any more bone loss and perhaps gain some back. So, thank you so much. This was my first time. I appreciate everybody's grace, but I had a wonderful time answering all these questions. I hope it was helpful.
You did great. You did so many questions. We have more coming in, but unfortunately, we are out of time. Thank you guys so much again for attending our office hours with Dr. Marrero. You can book an appointment with her if you become a member. Go to our website, palomahealth.com. Once you sign up for the membership, you'll be able, depending on your state, book an appointment with Dr. Marrero. And then again, if you would like to order a blood test or anything like that, what's great about our blood tests is that you don't need to get a referral from your PCP. You can order them directly online. They get shipped to your house, and you can get, an idea of where you're at as far as your thyroid levels. And I just love that advocacy for us as patients, because sometimes with, providers in the past, it could be difficult to even have them do the test kit. So you're taking your health in your own hands, and you're being proactive about it. And I love that. So again, check us out, palomahealth.com, download our free mobile app, tons of resources, blogs, workouts, all the things, and become a member. And